Welcome to Mysteries of Humanity, where we uncover the fascinating, often bizarre aspects of our shared past. Today, we're diving deep into a peculiar chapter in history, Victorian medicine. The Victorian era was a time of innovation, scientific breakthroughs, and industrial growth, but it was also a period full of questionable medical practices. From bizarre cures to downright dangerous treatments, doctors of the 19th century often employed methods that would shock and baffle modern medicine. In this video, we'll explore some of the strangest medical treatments Victorians believed in, whether it's the use of leeches, arsenic-based medicines, or electrifying their ailments away. Get ready for a wild journey into the curious world of Victorian medical cures. With one of the most infamous practices of the era, bloodletting. This was not exclusive to the Victorians, but they certainly popularized it during their time. Bloodletting, the idea of draining bad blood from a person to cure them of illness, was used for a wide variety of conditions, from headaches to fevers. Leeches were the tool of choice for many Victorian doctors. These small, slimy creatures would be placed on a patient's skin to suck out blood, supposedly relieving the body of harmful excess fluids. It was believed that an imbalance of the body's humors, blood, phlegm, yellow bile, and black bile, caused illness. By releasing blood, the balance could be restored. Some Victorians even kept leeches at home as part of their medical kit. But, of course, we now know that bloodletting had no real basis in curing most illnesses. In fact, it often made patients weaker due to the significant loss of blood. Nevertheless, it was a common treatment, and its popularity speaks volumes about the medical understanding or lack thereof during the time. Today, the idea of using poisons like arsenic and mercury as medicine would be unthinkable. But in the Victorian era, these substances were seen as miracle cures for many ailments. Arsenic was used in small doses to treat everything from syphilis to asthma. It was also a common ingredient in cosmetics and tonics, giving users a healthy pale complexion. Women even ingested arsenic wafers to maintain their appearance, risking their health for beauty. Mercury, another deadly substance, was used to treat a variety of ailments as well. It was often administered as a treatment for syphilis, a disease that plagued many during the 19th century. Victorians trusted this metal to purify their bodies, unaware that mercury is highly toxic. Prolonged exposure to mercury could cause severe neurological damage, tremors, and even death. Ironically, the treatments often left patients worse off than they were before. Despite the deadly side effects, both arsenic and mercury remained popular well into the 19th century, a testament to the risks people were willing to take for relief from their illnesses. While we associate electricity today with powering our homes and gadgets, the Victorians saw it as a potential cure-all. With the rise of industrialization came a fascination with electricity and its supposed healing powers. Devices like the electrotherapy belt became quite popular. Patients would wear these belts or use electric brushes to stimulate their bodies. The logic was simple. Electricity was seen as a force that could re-energize the body's natural functions. People suffering from everything from paralysis to depression were subjected to electric shock treatments. Some of these devices were as primitive as a metal rod connected to a battery, while others were more elaborate machines designed to jolt the body back into good health. Despite the fact that we now understand electricity in the body works differently, these early attempts laid the groundwork for modern electroconvulsive therapy, which is still used today, though in much more controlled, safer conditions. For the Victorians, though, it was one of the many experimental avenues they pursued in their quest for better health. Laudanum was perhaps the most widely used miracle cure in Victorian households. Made from opium and alcohol, it was prescribed for a wide range of conditions: headaches, menstrual pain, coughs, insomnia, and even emotional distress. For many, laudanum was seen as a one-stop solution to their health problems. However, there was a dark side to this wonder drug. Laudanum was highly addictive, and many Victorian-era patients became dependent on it, given its widespread use. Even children were given laudanum for teething pains or colic, leading to tragic consequences. Its addictive properties were well documented, yet the use of opium-based medicines continued unchecked for years. Famous literary figures of the time, like Charles Dickens and Thomas de Quincey, struggled with laudanum addiction, further illustrating its far-reaching impact. The Victorian fascination with this drug would ultimately lead to the rise of regulations and the eventual recognition of the dangers of opiates. The Victorian era was also the golden age of the snake oil salesman. Traveling doctors would go from town to town, selling miracle elixirs and potions, promising to cure any ailment a person could have. These concoctions were often made from alcohol, opium, or other ingredients that might make a person feel better temporarily, but did little to address the actual illness. These quack doctors thrived in a world where medical knowledge was scarce, and people were desperate for cures. Advertisements for these miracle cures could be found in newspapers and posters everywhere. Testimonials from patients praised the effectiveness of the products, though most of these were fraudulent. The Victorians' trust in these shady salesmen demonstrates the lack of proper regulation and medical oversight during the time. Today, these figures are remembered as charlatans, preying on the hopes and fears of the sick for profit. The strange and sometimes dangerous medical practices of the Victorian era may seem absurd to us now, but they represent an important chapter in the history of medicine. In their pursuit of cures, the Victorians laid the foundation for many modern treatments, even if some of their methods were deeply misguided. As we look back on these bizarre practices, we can appreciate how far medicine has come, and perhaps it serves as a reminder that what we accept as cutting edge today might look just as strange to future generations. Thanks for joining us on Mysteries of Humanity. Be sure to like, subscribe, and hit that notification bell for more fascinating explorations of history's strangest moments.